from speakers about their experiences and analysis of issues and trends. And that is why we call it Sharing the World with ASEAN. How does what is happening in the in other areas of the world, and how do global trends affect the people of ASEAN, and what can we learn from that? So we have three speakers, main speakers today. Our first speaker will be Mr. Manuel Edivaldo Santos Matos. He's the chairperson of the trade union in the Santarém town in the state of Pará in Amazon area, Amazon region of Brazil. He will talk to us about COVID-19 as threats for the forest-dependent communities in the Amazon, what have been the impacts, and also what have been the resistance. And in this, he will be translated and supported by Mr. Winnie Overbeek, who is the coordinator of the World Rainforest Movement, and Winnie is joining us from Uruguay. And I'm hoping that at some point, Winnie will also be able to share his views with us, because Winnie has extensive experience in the governance of forests. Our second speaker will be Mr. Larry Lohman from the Corner House. The Corner House is an excellent activist supporting a publishing house, which is based in the United Kingdom. And Larry has been in the ASEAN many times, has lived in Thailand and Laos, has been a long-time supporter of social movements and activists in our region, in the Mekong region and the ASEAN region. I don't know where Larry is joining us from today, but he's with the Corner House, and we invited him to talk to us about the green economy, what's happening with the green economy, because that really has very big implications for ASEAN. And our third speaker is Susan H. Ramika, who's the Secretary of Kiara, which is a People's Coalition for Fisheries Justice in Indonesia. She is going to talk to us about the blue economy and ocean grabbing. And Kiara has been at the forefront of struggles in Indonesia and also in the region to prevent the blue economy, ocean grabbing, marine grabbing, and the rights of fisherfolk, especially women in the fisherfolk, and also helping to link the struggles of fisherfolk with the struggles of indigenous people and small-scale food producers and workers to their rights. So without further ado, I will invite Mr. Manuel to please take the floor. Manuel and Winnie, please go ahead.
Ok, então mais uma vez bom dia. Meu nome é Manuel Edivaldo Santos Matos, sou aqui do Brasil, moro na comunidade rural, né, dentro de um assentamento agroextrativista, que é uma modalidade coletiva. Sou agricultor familiar, licenciado para assumir a diretoria do Sindicato dos Trabalhadores Rurais, Agricultores e Agricultoras Familiares do município de Santarém, como presidente.
Okay, so good morning, everyone. My name is Manuel Edivaldo Santos Matos. I live in the community called San Francisco. It is along the Arapiuns River, and it is in a project area. It projects a type of settlement for small-scale agriculture and for collection of non-forest products in a forest area called Lago Grande. It is in the rural area of the Santarém municipality of. And I'm a small-scale farmer, but now I'm dedicated to the board of the Rural Workers and Farmers Trade Union of Santarém as the chairperson. Ok, Manuel, pode continuar.
Então, o processo de enfrentamento na nossa região só aconteceu a partir de primeiro uma lei federal, depois uma lei estadual e, por fim, uma lei municipal. Tudo isso no início da pandemia, fevereiro e março de 2020.
Okay, so the process, our place of facing the COVID pandemic in our region, it only started when first federal law and then state law, the level of our state of Para, and finally a municipal law in Santarém was made and approved. And this happened during the time when the pandemic started in Brazil in around February, March 2020. Okay, Manuel.
A partir da determinação pelo governo municipal, veio o desafio de como a população do campo, da floresta e das águas pudesse ter acesso às informações para os cuidados preventivos e evitar o contágio nas comunidades e aldeias.
So, when the municipality approved its law, a big challenge was of how the people in the forest areas, the people living along the rivers in our region could get access to information, about how to prevent to get infected people in the communities and the villages. Manuel.
Então, a organização não governamental Projeto Saúde e Alegria, o sindicato e o Conselho Indígena Tapajós Arapiuns se juntaram para captar recursos financeiros e materiais para fazer a campanha Saúde e Alegria sem Corona, pois o poder público pouco se importava com a população, principalmente da zona rural.
Okay, so at that time, the non-governmental organization called Project Health and Joy, together with our trade union and together with the Indigenous Council of the Tapajós Arapiuns region, we all joined hands to find financial support and to purchase materials and start a campaign that we call Health and Joy Without Corona, because the authorities did not really care about the population, especially in the rural areas. And I think, Ian, there are some pictures you can show from this. Okay, Manuel.
Aliás, o governo brasileiro, liderado por Jair Bolsonaro, sempre fez e faz campanha contrária, sugerindo um tratamento precoce com cloroquina e outros remédios sem comprovação de eficácia e sem priorizar a vacinação, o que tem contribuído para o grande número de mortes aqui no país.
By the way, the Brazilian government, led by President Jair Bolsonaro, since the beginning, his government has campaigned against the attempts to prevent the spread of the coronavirus. What Bolsonaro did do was promoting the idea of an early treatment, he calls it, with chloroquine and other medicines without any scientific evidence of effectiveness against coronavirus. At the same time, he didn't give priority to what was really needed, the vaccination. And this has contributed to the big number of people dying of COVID in Brazil. Okay, Manuel.
Com a campanha, através de panfletos, cartazes, programas de rádios e a distribuição de materiais de higiene e limpeza, entre eles álcool em gel e máscara, não foram suficientes para evitar o pior. O vírus chegou nas comunidades e aldeias, onde muitos ficaram doentes, levando trabalhadores e trabalhadoras rurais e indígenas a óbito.
With the campaign using pamphlets, using posters, through radio programs and distributing hygienic and cleaning materials like alcohol gel and face masks. All of this we did, but it was not sufficient to prevent the worst. The virus got into the communities to our indigenous villages too. And many people got ill, and several people from the rural and indigenous communities died. Okay, Manuel.
O Sistema Único de Saúde, o SUS, entra em colapso e Manaus, no estado do Amazonas, sempre foi o termômetro para Santarém. Como os leitos dos hospitais não suportaram mais as demandas, Santarém enviava pacientes para outros municípios e até para outros estados, tudo de avião, que na maioria das vezes não retornavam com vida. Imagine como era o sofrimento dessas famílias.
So in Brazil, we have a public universal health system, call it, and the system collapsed during the pandemic, and it started in the main town in the Brazilian Amazon region. The town is called Manaus, and this collapse had its impact on the situation in our town, Santarém, a smaller town. So the hospital beds, they could not support anymore the demand, also went into collapse. And Santarém, our town, had to send its patients of COVID to other municipalities and even to other states of the country. And this had to be done by airplane, of course, and these people, they went away alive, but most of the time, in most of the cases, they did not come back alive. So you can imagine the suffering of families. Emmanuel?
Se na cidade os hospitais estavam com os leitos clínicos e de UTI esgotados, o que os doentes da área rural vinham fazer em Santarém? Se o poder público municipal dava pouquíssima assistência à população rural.
So while in our town of Santarém, the hospital was totally overloaded and the intensive care units totally full, what would patients, people coming from the rural areas, from the communities, come to look for in town? What would they come to look for if also the municipal government gave so little assistance to them? Okay, Manuel.
Então, as organizações da sociedade civil buscaram parcerias para adquirir cesta de alimentos, inclusive da agricultura familiar, para distribuir às pessoas mais vulneráveis, principalmente quando passamos por 2 períodos de lockdown aqui em Santarém.
Então, this was the reason that the organizations of civil society I have mentioned before started to look for supporters to buy food baskets, and in particular directly from the small-scale farmer communities in our own region, with the objective to distribute to the most vulnerable people, in particular when our town Santarém went through 2 periods of lockdown. Okay, Manuel.
Sem remédio eficaz indicado pela medicina para atender às necessidades das pessoas carentes, entra em cena o conhecimento tradicional na produção de remédios caseiros, pois os nossos ancestrais sempre utilizaram a medicina tradicional. Juntando o poder das ervas medicinais e a fé, muitas vidas foram salvas.
So without an efficient medicine, without a solution by the medical authorities to treat COVID, and especially for the most vulnerable people, they had not any support and any assistance. The traditional knowledge of our ancestors that we have always been using and produced the traditional medicines has been very, very essential, and combining the power of the medical herbs and together with our faith, we could save a lot of lives. Emmanuel.
Enquanto paramos todas as nossas atividades nas comunidades, priorizando a vida, respeitando todas as medidas sanitárias, o governo passava a boiada, incentivando o desmatamento da Amazônia, com exploração e exportação de madeiras ilegais, garimpos em terras indígenas, o avanço do agronegócio liderado pela soja nas terras dos agricultores e agricultoras familiares, terras indígenas e terras quilombolas.
So while we stopped all of our activities in the communities with the only intention to save lives and to respect all the sanitary measures, the restrictions and so on that the government put in place, at the same time the government itself speeded up the process of implementing measures to weaken the environmental laws, to reduce its capacity to monitor the deforestation. And actually, our government encouraged deforestation in the Amazon during this period and encouraged, for example, the export of illegally extracted timber. It promoted the mining inside indigenous lands. It promoted the advent of agribusiness, especially the big soy plantations over the lands of small-scale farmers in indigenous territories and also inside communities, inside other traditional communities. These are Black Afro-Brazilian communities we call quilombolas. Manuel.
Durante a pandemia, ficamos impossibilitados de fazer qualquer atividade para combater esses outros vírus. Porém, encontramos algumas alternativas para amenizar o problema. Entre elas, o rádio e os mecanismos de comunicação virtual, até que chegou a vacina. E quando fomos imunizados, aos poucos fomos retornando às atividades, tomando todos os cuidados. Afinal, nem todos já foram vacinados e o vírus continua circulando por aqui.
So during the pandemic, it was impossible for us, trade union, to do any activity in the field to combat all these other problems I just mentioned. And Manuel calls them other viruses, other viruses. However, we found some ways to continue active and to try to at least alleviate the problems. For example, with the help of our own radio stations, the community radio stations, and also using platforms of virtual communication, we could continue the work. And now that the vaccine has arrived, the vaccination started, we could little by little pick up again our usual activities in the field, but still always taking a lot of care not to spread the virus. And especially because nowadays still a part of the population not vaccinated, and the virus continues circulating around here. Okay, Manuel.
No Brasil, os dados oficiais apresentados até o dia 22 de setembro são 21.283.567 pessoas foram infectadas pelo vírus. Dessas, 592.316 pessoas morreram. No estado do Pará, são 588.964 pessoas infectadas. Dessas, 16.617 pessoas morreram. Aqui em Santarém, município com 300.000 habitantes, foram 21.002 pessoas foram infectadas e desses 1.094 perderam a vida.
So in Brazil, some figures on the COVID-19 pandemic. So until the day before yesterday, we have 21,283,567 people infected by the COVID-19 virus. And of these people, 592,316 people died in the country. my own state of Pará, the Amazon state of Pará, 588,964 people infected and 16,617 people died. And here in my municipality in Santarém, it is a municipality with 300,000 people. There were 21,000 people infected and 1,094 people died from COVID. Okay, Manuel.
Conclui dizendo, se não fosse a ciência dos indígenas e povos tradicionais, as comunidades teriam sofrido muito mais durante a pandemia do novo coronavírus. E meu muito obrigado pelo convite e pela oportunidade. Fico à disposição para algumas perguntas, caso tiver.
So my conclusion is, the final words is that if it wasn't for the knowledge of the indigenous and traditional communities and peoples, our communities would have suffered a lot more during the pandemic of the new coronavirus. And I want to thank you very much for this invitation, the opportunity to be in touch with you. And if you have questions, I'm very happy to reply to them. And thank you very much.
Thank you. Thank you very much, Manuel, for sharing the conditions and the impacts and the way your community is organized. And thank you very much, Winnie, for translating for us, because if you weren't interpreting, we would not be able to learn from the experiences of Manuel. What Manuel described has also been experienced in many areas in India, in Thailand, in Philippines, Indonesia, and other places where basically local communities organized and helped each other and had to work out their own systems of health, combining traditional medicine, ancestral wisdom, local practices, combining that with whatever was available from the pharmaceutical sort of, not industry, what's the word, pharmaceutical, allopathic medicine, that's the word I'm looking for. Because here also across Asia, basically public health systems broke down completely. And of course, our public health systems in Asia have been undergoing privatization and public disinvestment for so many years that in many rural areas, you know, there's not even a hut or a small building which can count as a primary health care center. So I think there's a lot that we can learn from how you organize there, and I hope we have more discussion about this later. Thank you again, Manuel.